Today, your technologist will demonstrate the elbow views. We'll start with the AP elbow. Patient seated at the end of the table. A 10 by 12 placed lengthwise on top of a sponge. This is to keep everything on the same plane. So we supinate the hand. We want the epicondyles parallel with the image receptor. The humerus, elbow, and forearm are all on the same plane. We're going to center at the elbow joint. We want our collimation 3-inch proximal and distal to the elbow joint with 1 inch on each side. We collimate, leave that 1 inch for our correct marker to be placed there, and we are ready to take the image. We'll move on to the lateral elbow now. Patient seated at the end of the table. All we're going to do is flex the elbow 90 degrees. We're still centered to the image receptor and centered at the elbow joint. We want 3 inches proximal and distal to the elbow joint, and our correct lead marker is placed in the light field. And we're ready to take the image. We'll now move on to our AP oblique. We will start with a lateral rotation. The patient has to roll their arm in order to get the joint at a 45-degree angle. We're going to center at the elbow joint. We want everything on the same plane. 3 inches proximal and distal to the elbow joint for collimation and 1 inch on each side, leaving room for our correct lead marker. For the medial rotation, patient will roll her arm, and it needs to be the elbow at 45-degree angle once again with the arm medially rolled. And usually this is accomplished by just placing the palm of the hand down. We collimate 3 inches proximal and distal with 1 inch on each side, leaving room for our correct lead marker. And we are ready to take the image.